like Everett already told, colleague of him, I counted, we have worked on 8 different sexual and reproductive health programs together. Yeah. I have learned a great deal from him and about him. And he knows nowadays much more about health economics than he says. My presentation is 2 parts. First one this is going to be on the youth clinics. Everett talked about the school program, and I'm looking at the other pillar, which is the youth clinic. So first we are going to talk about the money, what the youth clinic program costs. And the second part will be a policy part on, from our point of view, what were the success factors in Estonia. And these studies were made for the international audience. So, yeah, let's start with the costing part. First of all, for clarity, I'm not representing WHO. I'm presenting results of the research what we did for them. So, why the 2 cost analysis of the youth clinic networks? What is it in for WHO? The youth clinic youth-friendly sexual reproductive health programs, they have a high priority in many countries, so that little is known how much the programs actually cost. And why did we come to Estonia? Like Everett already told, Estonia is an excellent example for other countries. There's a countrywide implementation. The adolescent sexual reproductive health outcomes have improved, and there's a good data. So first we looked on a program level, how much the program cost between 2002 and 2012, where the money came from, and what the coordination of EHIF costed. So I'm going to show only the results. I will not bore you with the methods. The total cost for the 11-year period were 8.3 million euros. The blue bars are the costs, and well, it reflects that there's more clinics and there's more patients and so forth. So where this money came from? Well, it's quite obvious here that the Estonian Health Insurance Fund is the main financier. Then there's a little bit of money coming from other sources, but 95% is covered by health insurance. Then the coordination costs of ESHA. There's for the 11 years, the budget of ESHA was 300,000 euros, which is only 3.6% of the total cost of the youth clinic network. So this is a relatively small cost or small portion. If we compare it to another standard, I looked at the European Commission accepts for the coordination up to 7%. Also the umbrella organization of NGOs in the Netherlands, also 7%. So I think my message here is that the ESHA has done it quite cheaply, but at low cost, and maybe they can ask for more. Because well, it's half of the 7%. Then we scroll down, we looked at 1 year cost at the clinic level, what it costs per clinic, and these are again examples from other countries. On what the clinic spent the money, what it cost per patient and per service. So we looked at different aspects. We selected only three clinics, Qalys and Tartu and EHIF, because we did not have the resources to look all of these. Tartu and Qalys because they are the biggest clinics that represent more than half patients. So, yeah, so 2 bigger clinics, 250,000 euros per year. The rest of the clinics are small. Ida-Virumaa was 42,000. Then if we look how the clinics, on what they spend the money. So the blue bit, 35% goes to salaries of personnel, 33 medical supplies, and 25 on operations. This is not operations based, but clinic space, office, and so forth. So 3 main categories. Then there's ESHA coordination cost, internet counseling, and personal training. The training is it's relatively small, but because it's already old program and the majority of the training has already been taken place. Then cost per patient. When one person walks in, how much on average cost? So the 3 clinics, they got 340,000 from the Health Insurance Fund in 2012. They reached almost 20,000 patients. So then on average comes 28 euro per person. Then if we break the services down, how much it actually costs per service type. Well, total cost, number of services, what it costs per service. STI consultations, they were the most expensive, but that is because most of the time it requires a test and number of follow-up consultations. For reproductive health counselings were 13 euros per service. Contraception consultations were 9 euros. That is cheaper because normally, at least when they are coming for the repeat prescription, the visits are shorter. Then one of the findings was that the internet counseling was surprisingly expensive. But actually there's a kind of logical reason for that, because answering the emails, it is time insensitive. You always you reply to one email. And the sex education lessons, they were the cheapest. 1.5 euros per person read. That is because those are always in the groups. Yeah. Then this is estimations. But even estimation, one can conclude that the youth clinics have high coverage. If the target populations are 155,000 young persons, the 80 clinics reached in 1 year 33,000 persons. If we estimate it on average as 1.5 visits per person, it comes that the coverage per year is 14%. So it is high coverage. Maybe this is a little bit on the higher side, but it's an